we haven't formally acknowledged Robert Price, and I think it is important to do that. Robert, thank you for your commitment to these issues and to being willing to help partner in this conference. This is something that I hope becomes a lasting and ongoing partnership so we can keep advancing these policy issues because it's very important. So thank you very much. We all appreciate it. Okay, so next is the foundations. I guess we call it the foundations panel, but you're not all foundations, so we shouldn't do that. The leaders panel from national organizations. We have 3 leaders who are really on the front lines of these issues, grappling with what should we do, how do we talk about issues of poverty, and how do we engage a broad range of stakeholders. And so I want to make sure that we leave plenty of time for that, so I'm not going to say very much other than we have Robert Greenstein, who has just left the building. We have, and he is the president of the Center on Budget and Policy Priorities, and he's just returned. So, hi, Rob. We have Terri Ludwig, who is the president and CEO of Enterprise Community Partners, and we have Patrick McCarthy, who is the president and CEO of the Annie E. Casey Foundation. You have their bios in the program. These are 3 real shining stars and leaders in the field. So let's get to it.
Good morning, everybody. There's next steps on poverty, opportunities, and threats. That's a lot to cover. Fortunately, Sheldon, I can't see where Sheldon's sitting right now. Sheldon covered important areas. Sheldon covered important ground, and I'm going to quickly jump over my first few slides since he really covered them. As Sheldon talked about, the fact that when one, as a context, when one measures poverty properly so you do count things like food stamps and the earned income credit and rental vouchers, that the poverty rate really has fallen significantly since the 1960s. Or if you use this broader measure of poverty, the supplemental poverty measure, we find that for the latest figures, 2012, the safety net cuts poverty nearly in half. When we look at some of the areas program by program, we see particularly large effects in lifting people out of poverty from refundable tax credits. But this slide is really a partial slide. So I presume I can walk away from the mic. These bars show you that the refundable credits have the biggest effect in lifting people above the poverty line. But that's not the only measure we should care about. We should also care about reducing the depth of poverty. Lifting someone from 25 to 75% of the poverty line, you don't get credit for lifting them out of poverty. You do if you just go from 95% to 105%. So when we ask the question, which program has the largest effect in reducing the depth of poverty, it's food stamps. They both have big effects. I was thinking of this when Robert Price asked his question to Sheldon. Robert, you mentioned your impression, which I think is exactly right, is that in many respects, poverty is much less grinding than it was in the 1960s. One of the most riveting pieces I've ever read related to poverty was a report that came out in 1979. A foundation no longer in existence, the Field Foundation, had sent a team of doctors to the Deep South and Appalachia in the late 60s looking at hunger and malnutrition, and they found really stunning results. It was the basis for the Hunger USA documentaries of that period. The Field Foundation sent another medical team, a lot of the same doctors, back to the same areas in the late 70s. During the intervening decade, food stamps had been expanded and go nationwide, and other nutrition programs like the WIC program and others had been created. And I'm not going to remember the words precisely, but the report said something like the following. They said, 10 years ago, visitors could quickly see the dull eyes and slowly healing wounds of child malnutrition wherever we looked in these areas. Today, 10 years later, such children are rare. That's a pretty significant accomplishment. Now, until a few years ago, we tended to think of the safety net, these kinds of assistance programs, as when they were really effective, they would reduce hardship. Critics argued that they became a dependency-creating hammock and did more harm than good. What wasn't part of the debate, and what we really didn't have much evidence on for the last few years, is what we're now beginning to learn due to the work of a number of researchers, including very much Greg Duncan, who's sitting here, that various aspects of the safety net not only ease hardship, but they actually serve an opportunity function. So Greg talked in his presentation yesterday about a growing body of research that providing significant, we're talking several $1,000s or more, I think, amounts of additional income to families with kids, especially younger kids, is now tied to improved school achievement. In some of the studies, improved employment and earnings as adults, probably relating to the improved school achievement. Another really important study was one done by Hilary Hoynes and her colleagues. They were able to take advantage of something unique. In the late 60s and early 70s, the food stamp program went nationwide, but it did so slowly, in many areas, county by county. They were able to look back 30, 40 years later at children who grew up in counties that had food stamps and similar children in neighboring counties that did not have food stamps. What they found was stunning. They found that poor children whose mothers had access to food stamps in pregnancy and the children then had access when they were growing up, decades later, had lower rates of metabolic syndrome, stunted growth, heart disease, obesity, and these are percentage point changes, an 18 percentage point higher rate of high school completion. So these are particularly important findings. So while we've made a lot of progress, however, as I think has been a theme of this conference, we have a long way to go. Among the most disturbing, if the research I just mentioned is heartening, among the more disturbing recent research is we're also learning more and more about how many differences emerge just in children's first 2 years. Important work being done by Jack Shankoff at Harvard and his colleagues on the role of toxic stress on very poor families with kids and the effects that this has on children. And when you put the two new emerging pieces of research together, it suggests that having more income and of particular importance, having a stable place to live for families with children is, again, it's not just a safety net, reduce hardship function. There are significant long-term effects here. And here we have a negative development. The negative development being that the percentage of low-income households who do not have affordable housing due to changes in the housing market and other developments has been increasing in recent decades. We also have another concern. As the economy changes such that the returns to education become more important, we have growing gaps between tuition and income growth with particular consequences for low-income households. Aggravating this has been state budget cuts. States have to balance their budgets every year, unlike the federal government, even in recessions. So during the Great Recession and the aftermath, states faced deficits year after year and did cuts and cuts. One of the areas that's have been cut the most is state funding for higher education, which is one of the factors in these rising tuition rates. Now today, state revenues are coming back, more in some states, less in others, but in general they're coming back. What do states do when the revenues are higher than the year before, even when the year before was at a depressed level? Do they ease cuts in higher education and K through 12, where the cuts have also been significant? Do they invest in new emerging poverty strategies coming out of conferences like this and other research when people find things that work? In too many states, the policy that's on the table this year is revenues are coming back, let's do more tax cuts, and leave the budget cuts in place. There are a number of states today where governors are proposing to actually eliminate the entire state income tax, permanently shrinking the revenue base. I'm not going to spend more time on this other than to say, and I think Jack Knott was exactly right on this, there is a relationship here. Having enough resources doesn't mean you have effective policies to address poverty. But if you shrink the resources, we're going to cut programs that reduce poverty, and the atmosphere in which it's often hardest to innovate and try new things is when the total pie is shrinking and everybody's protecting their existing piece of the pie, including service providers, program administrators, and other groups. So I would argue that the battle's now going on in a number of states over whether to cut taxes, what to do, should be viewed in part as poverty-related battles, because a necessary but not sufficient condition is the public sector having sufficient resources. We have another big problem, which is the change in the employment picture. In all of the recessions going back to 1950 before the present one, we never had more than 26% of the unemployed being long-term unemployed, out of work for more than 6 months and still looking. It got up into the mid-40s, and it's still about 35, 36, 37% today. This is really unusual. I'm sure you all know the research. Long-term unemployed have much harder time going back into the labor market, getting jobs. And this underscores a larger theme, which I wasn't here yesterday, but from reading the notes, I'm not sure there was that much emphasis on this, but it is simply another necessary, not sufficient, but necessary ingredient is the state of the economy in terms of employment and wages. When we look at the late 1990s, admittedly, a particularly hot economy, but the unemployment rate fell to 4%. When the unemployment rate fell to 4%, a lot of people on the margins with limited education and skills who were often thought of in conventional poverty discussions as being unemployable got jobs because the labor market was so tight. And a second factor was that because the labor market was so tight, real wages rose at the bottom. Now, we're not going to get back to 4% unemployment, most likely, but the larger theme is that one of the most effective anti-poverty policies is a full employment economy. And macroeconomic policies that take us closer to that, and this includes maybe tolerating a little higher inflation to get lower unemployment. These are important issues from a poverty standpoint. Right, I'm going to move now to some of the programmatic type issues. And I've mentioned the importance of things like SNAP and other programs of that sort. A number of people have mentioned Medicaid. So this suggests that one thing we want to do is to raise where possible the percentage of eligible low-income families and individuals who qualify for these programs and actually get them. Surprisingly large progress can be made here. In 2002, 54% of those eligible for food stamps received them. Today, it's 79%, and over 90% of the eligible children receive them. There were a lot of changes made in rules, processes, procedures to really simplify this. And the advance of the information technology age is opening up major new possibilities. As some of you may know, a number of foundations, the Urban Institute, and our center are all involved in something called the Work Support Strategies Project. The idea behind this is to get beyond the silos, where we still are in many states, is you're a working poor mother. You have a low-paid job. You don't easily get time off. You're on food stamps and your employer doesn't have offer health coverage, you're on Medicaid. every X months, you have to go reapply. It sometimes takes multiple visits, multiple hours at the office. It could create problems for you with your employer. You're probably at a minimum not paid for those hours. You finally get it done, and 2 months later, you may have to do the whole thing all over again for the other program, which also contributes to, as is well known in the field, high rates of churning, where people who remain eligible fall off the program for periods of time. So the idea in the Work Support Strategies project is to link the application processes, use information technology to share verification documents, so you renew your eligibility for food stamps and it automatically renews you for Medicaid. And as you begin, and we have 6 states, this is a project with 6 states. I should have mentioned the key really is less the Urban Institute and us, but the 6 states. There are 3 bright red states and 3 blue states, and they are all equally enthusiastic. If you're a red state, you might say, gee, why do they want to increase participation in these programs? Well, among other things, this increased efficiency means they need fewer state staff, and they lower administrative costs, and that can be very appealing. So there's a potential for bipartisan progress here. And as we learn more how to do these things, it opens up other avenues. So another example, about 18 months ago, we were looking at the fact that there were 47 million people on the SNAP food stamp program. So millions of these people would have to be people who are uninsured today but would be eligible for Medicaid if their states took the Medicaid expansion. When we began to discuss this with agencies in the federal government, we encountered a problem that a number of you discussed yesterday, siloing. So we were told, nice idea, guys, but nothing we can do about this because Medicaid and SNAP have different rules for what counts as income and who's a member of the household filing unit. So we went over both programs' eligibility rules and details, and we were able to design a screen, a series of questions. You simply have your IT contractor convert into an electronic thing. You run through your whole SNAP caseload. In the typical state, 80% of non-elderly households meet the screen. If you meet the screen, you are eligible for Medicaid under the expansion. If you're in the other 20%, you're probably still eligible, but you need to go through the normal process and ask more questions. But for the other 80%, you can automatically enroll. So the government adopted it as a state option. California is rolling it out right now. The first 4 states, California is the 5th, that put it in place, automatically enrolled over 300,000 people on January 1st. With California, we're getting up close to 500,000 now. New Jersey's coming in. These kind of things can be a wave of the future. It opens up a possibility to think about having organizations on the ground do civic engagement work and ask the governor, the legislative leaders in a state, for example, to make a commitment that to try to have a goal of trying to reach all or nearly all low-income children, let's say, or children and parents who are eligible for certain basic federal programs, to actually enroll them. Once you get the commitment, you can then work on the specific information technology and other mechanisms in the state, but I think there are potentials for major advances here. Of course, part of this relates to whether a state accepts the Medicaid expansion. I think there's a strong case to be made that the decision on whether or not to take an expansion under which everybody below the poverty line, except, of course, certain immigrant populations, are eligible for Medicaid or not, this is really probably the most important state anti-poverty decision in policy in a quarter century. Prior to the Affordable Care Act, in the typical state, a working poor parent has lost eligibility for Medicaid when their income reached 63% of the poverty line, a non-working parent 37% of the poverty line, and childless adults not eligible at all. So these are really important issues. And when you get to the childless adults, here's another really important area for work, study, academic research, practitioner work. Taking the Medicaid expansion opens up a new round of possibilities to make progress on criminal justice reform. How's that? The sheriff of Cook County in Illinois is now trying to develop a program whereby people who are brought in for various nonviolent offenses, instead of being tried and put in jail or in prison, will be enrolled in Medicaid and given various kinds of mental health and substance abuse counseling. There is interest in several states, including California, in the concept of we release something like 600,000 people from prison every year since we incarcerate so many. Generally, in the past, these people are released, and among others, not only do they not have jobs, they're uninsured. There's inadequate mental health treatment. The new notion is enroll them in Medicaid before they're released. So they walk out the door of the prison and they are eligible for preventive care, basic health, mental health services, and substance abuse. There is hope. We don't have any results yet. Nobody's done it yet, but there is hope that the improvement in health, the greater availability of mental health counseling, substance abuse counseling, could help people in the employment market, could reduce rates of recidivism. We'll see. But there are really new, exciting possibilities here, but they can't be seized if a state doesn't take the Medicaid expansion to begin with, because then most of these people remain ineligible for Medicaid. I mentioned the issue of jobs and wages, which takes us to a discussion you've been having. There's the issue of the minimum wage, but there's also wage supplementation through the Earned Income Tax Credit. Greg talked yesterday about expanding the Earned Income Credit for families with young kids. I put even a higher priority, although one can certainly debate this, on the workers who aren't raising minor children. As you can see today, they're eligible for a tiny EITC. The average benefit is $264, and this understates the differences because it's also the case that the EITC for childless workers cuts off at about $14,000 a year. It's really small. So we know that the EITC for families with children brings more mothers into the labor market. We know we have a big problem with low labor force participation rates among young people, including young minority males. The current EITC not only is tiny, but if you're under 25, you're flatly ineligible for it. The Obama proposal would make people eligible at age 21 and significantly increase the size of the Earned Income Credit, and as a result, it would result in several million people additionally being made less poor and some lifted out of poverty. Among the group who would benefit are 1.5 million non-custodial parents, which could be important for paying child support for the children, and substantial numbers of formerly incarcerated individuals. So this again fits in with the problem that we're increasingly beginning to understand is critical to thinking about poverty, the large numbers of formerly incarcerated individuals. The hope is that a significantly larger EITC as a wage supplement here could bring more people into the above-ground economy, improve employment, and possibly, Carl Scholes at the University of Wisconsin has written about this, possibly reduce crime and subsequent incarceration rates. By the way, if we're talking about the Earned Income Credit, there's a future issue coming. If we get immigration reform, which I would agree is one of the most critical issues for poverty reduction, and millions of people are on a path to legalization but are years away from being legal permanent residents, what are they eligible for? So when the Senate immigration bill was on the Senate floor last year, there was an agreement without which the bill would have had little bipartisan support, that once you became legalized, until years later you got to LPR status before citizenship status, that in that number of interim years you would not be eligible for food stamps. You will not be eligible for Medicaid. There would be hardly any Republican support, and a lot of Democrats wouldn't have voted for it either without that. But you're working, you're paying taxes, are you eligible for the Earned Income Credit? When the debate started on the Senate floor, the Senate Democratic leaders of the bill told us and others it would be great if people could get the EITC during that period, but they couldn't sustain it and pass it on the Senate floor. There was a lot of work done, and we kept the EITC. So under the Senate bill, when you become legal, even though you're not eligible for the other benefits, you're working, you're paying taxes, you do get refundable tax credits. If and when the House ever takes up immigration reform, sooner or later, probably not this year, but it'll eventually happen, I think we're going to have a big battle, a big debate over whether should legalized immigrants be allowed to get refundable credits. They're part of the tax code. They're part of what we've done as a country instead of raising the minimum wage more. It would be a very large problem for them to be denied. I just want to close with a couple of minutes on the federal budgetary context. My talk was entitled, the first slide said, Opportunities and Threats. There are threats. We've done $4 trillion of deficit reduction in the last few years. 4/5 of it have been program cuts, and 90% of that blue program cuts, 90% of that has been reductions in non-defense discretionary programs. That's the part of the budget that's everything that isn't defense, isn't an entitlement, and isn't interest payments. It includes almost all the services we've been talking about here. It includes low-income housing, Head Start, all kinds of other things, and it is now on track, unless there is another budget deal to ease sequestration, to by fiscal 16 be down 17% below the 2010 real level. And that understates it because veterans' health care is part of this part of the budget, and it's going up faster than inflation. There are some Pell Grant financing problems. I won't take the time to go into them. The bottom line is that for everything else, if there's not a change, we're looking at a reduction of well over 20% in real terms by fiscal 16 and continuing to fall after that. In fact, we are now on track that by 2016 or 2017, total non-defense discretionary spending as a share of the gross domestic product will fall to its lowest level on record going back to 1962. It is going to be very difficult to do various things talked about in this conference if this plays out. Instead, we'll be talking about what's the triage, which programs do we cut the most, which gets me to my final point, and this is the Jack Knott point. Jack said a few minutes ago, aren't revenues fundamental? Yes, they are. We're going to have to both reduce the deficit more for the long term, and we need to finance new initiatives and investments. Part of it is going to have to come from other spending programs. But unless part of it can come from the tax side, this is going to be a very daunting task. We have in the tax code what are called tax expenditures. They're basically subsidies, deductions, tax credits, various kinds of write-offs, exclusions. They're called tax expenditures because they really are the equivalent of spending through the tax code. Martin Feldstein, who was the chair of President Reagan's Council of Economic Advisors, has written repeatedly in the Wall Street Journal that conservatives should view these as government spending and recognize that they are, on average, perhaps the most inefficient area of government spending, and they have major distributional and poverty consequences. Two examples. Example one, childcare. If you are a low-income family and you need you need childcare to go to work, you might be able to get a federal subsidy through a federal spending program, but the funding for the child care programs is limited. Only 1 in 6 low-income families that meets the income criteria for a child care subsidy gets it. If you're a middle or an upper income family, you get a child care subsidy from the federal government too. You get it through the child care tax credit. That is the equivalent of an open-ended entitlement. There is no limit. 100% of those who qualify and take it on their tax return get it, and it goes all the way up the income scale. One's taxes, one's spending. As long as we have fiscal debates where taxes and spending are treated as two totally disparate things, it means that it's more acceptable to cut child care, without which some low-income parents can't work, than to reduce a subsidy that in the absence of which people at high income levels are going to use childcare anyway. A similar example is student aid. Pell Grants are spending, they're the blue bars. Tax-based student aid, 529s, other kinds of things, tends to be worth more as you go up the income scale. My two last slides. Here's the distribution of entitlement benefits. Bottom fifth gets about 32%, top fifth about 10%. Tax expenditure benefits, what Alan Greenspan has called tax entitlements. Top fifth gets 2/3 of them, 3% to the bottom fifth. So unless we can broaden our discussion and treat tax expenditures as government spending just as the rest of spending, and when we talk about redistributing resources, as you've done yesterday, today, what works, put the money where we can have the best return. If the tax expenditure side of the budget is not part of that equation, we are more likely to go backwards than forwards. And I would just close by saying that to me, this underscores the wisdom, the prescience of the individual for whom this skull is named, Saul Price. Saul, as Robert could say better than I, but one of his passions was tax policy. He deeply believed that we should raise more revenue in a progressive way, part of which could then go to making more progress on poverty as we find more and more what works. Thank you.
What a great stage setting that is. Terrific. And so critical for us to reflect. I think I'm going to come full circle as I introduce myself and talk at the end of my presentation about the road ahead. A lot of risks out there, but taxes is absolutely front and center for all of us. So it's great to be here. Thanks for the opportunity. I'm Terri Ludwig, as Raphael said, and I'm the CEO of Enterprise Community Partners. Many of you might be familiar with Enterprise, but for those of you that are not, Enterprise is a national nonprofit working to make sure that everyone has a safe and affordable home and is connected to opportunity, and we work across the country to achieve this. So it's great to be here today, and I think I'm the practitioner here who's going to kind of ground us in some of the practice, as Raphael said, of what we see as some bright spots, what are some of the things that are working on the ground, and then, getting back to what we just talked about, some of the challenges we see in the road ahead. It's just as, context setting, I would say, we were founded 30 years ago by a private real estate developer, Jim Rouse. And Jim was very confronted in his development of real estate, across the country. He was just really confronted by the deep poverty that he saw facing our country. So he set up Enterprise really to take local solutions, figure out what was working, and set up partnership and lift those up all through public-private partnerships to really try to drive change. So that is very much our mission. That's what we bring. We've brought for 30 years. So we've been in, Raphael said, we're one of the players that's probably achieved some scale. We've also been at this for a very long time. So the things I talk about today are really building off those successes and many failures over the past 30 years and thinking about, what comes next. But I would say, what's remained very much at the core of Enterprise during that time is a deep commitment to eradicating poverty, number one. Number two, a deep belief that it wasn't just the public sector that can do this alone. It has to be public-private sector. So working very closely with the public sector, philanthropic sector, the private sector to really achieve some solutions. And I would say also just a really healthy respect for local solutions and thinking about how to lift those up. And so our mission remains, how to ensure that every American has a safe, affordable home connected to a diverse and thriving community. So that's really where I start the conversation today. And at the core, in terms of our core competencies, Enterprise has been very much a housing organization, but our vision, as I just shared, is much broader than housing. We do see housing as an absolutely critical intervention to ending poverty, as I think there's a lot of, I wasn't here yesterday, but understand there's a lot of discussion on that. So I hope we can all agree on that one. And we certainly see housing as much more than just shelter, but we think that it's something that really does truly give families a fair shot at success. Doing well in school, landing a good job, staying healthy, we know can easily fall out of reach when you don't have that kind of stable foundation that a home really provides. And I think that's true for each of us in our own families. So that's our basic philosophy. Housing is the first rung on that ladder of opportunity, and that a stable home, is just essential, and it's out of reach for millions of families today. As many of you know, our country is in the middle of a broad housing insecurity crisis. A couple speakers already today touched upon this, but that, in cities across the United States with rents rising, wages stagnating, working families are having a harder and harder time to find a decent home. There's a lot of statistics there, but one that really plays out for me is that, when you're a working family earning minimum wage, you simply cannot afford an apartment at fair market rent anywhere in the country. I don't know, it seems pretty simple. There's a pretty big crisis there. So, and on any given night, there's about 600,000 people that are homeless. They're on the streets. Nearly a quarter of those folks are children. And I'm based in New York City, and I have to say it's really confronting to me when I think about what does that mean, practical terms, try to picture that, right? Not only the faces, but what does that mean? And in New York City, imagine Madison Square Garden is filled with children that are homeless. And there's still 4,000 seats that are needed, folks lining up out the door, right? So that's the scope that we're talking about. And then there's, a much larger, if we take all these numbers together, you have about 19 million people that are either homeless or paying over 50% of their income in housing costs. So those are the folks that are homeless, the paycheck away, the next homeless, because they're living so close to the edge. So those are the people that we're really focused on. Absolutely, if you're paying more than 30% of your income on housing costs, it's known to be a huge stressor and really hard to be affordable over the long term. But our focus is really taking us to say we have a huge population right here that's 50%. And what I want to shift, and I think we've seen this in the conversations over the last 2 days, but that this is not just a housing problem, but this is a much broader social crisis. Then we know that where you grow up and where your home is has a profound impact on the person you become. The health outcomes, your educational outcomes, and just generally your well-being, your well-being as an individual. One of the people I like to quote is, I've been really we were looking deeply at this intersection of health and housing. And there's a woman, Dr. Megan Sandell, who is the head of Children's Health Watch. And she calls housing a vaccine. And she says, that is really, it literally keeps kids healthy, and it provides preventative action against a whole host of other ills. So there is no doubt that we see in our work that if you have unstable housing, poor quality housing, that you are really affected by outsized health risks. And certainly as we look at something like asthma, and I'll touch on this later, we see very dramatic changes, and we have the ability to influence that by the quality of housing that kids have. Kids are more likely to suffer from a developmental disability or a mental health issue. They're less likely to graduate from high school or more likely to abuse substances or land in jail. And we talked a minute ago about toxic stress. We're finding that toxic stress is so rampant in some of the places that we work. And so those stressors, whether they're mild or more extreme, have huge impacts over the long term. And certainly, we know that the trade-offs we make, we see it every day. We talk with the folks dealing with food insecurity, housing insecurity. If you're paying more for your house, you're trading off with basic necessities, terrible trade-offs that you shouldn't have to make. If you're paying more for your house, you can't buy as much food. We get that. So each of this has each of these factors has big implications on our society. So the way we view it is that, we can invest now or pay for these costs later. So a lot of the work that we're trying to do at Enterprise is really to think about what are those interventions that we can make today, how do we bust down some of those silos and make some of those investments today that can have longer term payoffs. It's hard. It's not the way, we're wired today in terms of our incentives, but we do think it's really important. And I have to say, if I'm on the optimistic end of the world today, we're seeing definitely some bright spots. So as we look at private sector participation in some of the investments that enterprise is making, we certainly see folks that are incented to do so through the Community Reinvestment Act. All the banks are coming in to invest in housing and communities. But there's a lot of people that don't have a natural or a federal or state incentive to do something, but they actually see a business incentive. So we're seeing people like, you might have seen the news with United Healthcare. United Healthcare is investing $150 million into housing, actually going out and investing to make sure it gets built. Why? Because they realize they're going to pay out higher premiums for the kids that they're insuring at the end of the day if they're not doing an intervention up front. We see people like Berkshire Hathaway. We've seen Google come in and do investments. And I think that's because, you are starting to see folks that want to come in, they want to participate in their communities. But they also have, in San Francisco, certainly you're seeing a lot of pressure there of folks that have a responsibility where their workers, really cannot be housed. So it's starting to become, a real economic issue and a real business driving issue. Okay, so that's the problem that we're facing. In terms of solutions, I guess I would want to say, first of all, just our basic model is we're looking very closely at affordability, availability, and homes that are healthy, well-designed, and sustainable, and connected to jobs, healthcare, good schools, and transit. So how do we actually do this? We take our three legs of the stool, if you will. There's three things that we do at Enterprise that we think are essential for lifting up communities. Not the only three things, but aggregating and leveraging capital and bringing that into communities, innovating solutions on the ground, and transforming policy. And the way we like to think about it is that, we're trying to drive public-private partnerships that bring in resources into communities. We know that the communities we work in are starved for capital. That we need to build affordable housing, primary health care centers, charter schools. We work to aggregate capital and bring that in. And to do that in a way that really requires a lot of business discipline so that we can go to people like United Healthcare and others and ask them to come in because we can provide something that is typically double bottom line or even triple bottom line with an environmental bent. Secondly, innovating solutions. We go deep in 10 markets across the country. We do this and we look at, including right here in LA, and when we talk about innovation, that is where innovation is happening. These are our idea labs where we're trying to say what really works on the ground, because we know it's the engagement with the various sectors that I mentioned that we have to really go deep in those markets. And so that's what we're doing, and that's where we're partnering up to deal with local issues and then trying to lift those up on a national basis in terms of what works. Transforming policy. It's really one of the things that I think is just fundamental about Enterprise and many of our colleagues in the field is that our systemic lens has to take into account policy. We can do all the work we want on the ground. If we're not lifting it up into policy solutions, our scale is never going to achieve the scale of the issues. What I think is what we have found really helps in our policy conversations is that we can point back to capital flows, what's working on the ground, and have real evidence and data to support our work. So that's what we're trying to do, and we do this, all this work, I should say, is in partnership and collaboration every single day with folks that are local, and many of you in the room, and really lifting that up into policy solutions, and we'll talk a little bit about that in a minute. So I'm not going to spend much time on this, but since Raphael said, one of the reasons I'm up here is because the scale at which we operate, I want to give you just a quick snapshot of, over the past 3 decades, we've invested about $16 billion into communities. And, if we look at how many homes that's created, we've helped, directly touch about 300,000 homes and touched millions of lives. So certainly a very good scale, yet we certainly are very challenged by what the need. And so we're challenging ourselves to be at a place like this where we're thinking about innovation and what are some of those next opportunities. Last year, we brought about $2.5 billion into communities, and we continue to try to grow that. So we're looking at our impact. This is just a snapshot of one piece of our impact. We're also, obviously, we're not only doing housing, we're doing childcare facilities, charter schools. So there's a lot of impact delivery that's not up here, and not to mention some of the systemic change that we bring through policy work. So let's dig a little deeper. I want to show you some examples. I'm going to go through a couple of examples that do a couple things. One is, what are some approaches that are working in local markets that we think have the opportunity that we can expand more broadly. One of the interesting programs that I have seen is a housing first model. So we have a program in Cleveland, and Enterprise has been leading with some of our other partners, working with local leaders to end homelessness. And this isn't just about fighting poverty, but we're also framing this around the cost savings. So really important work that's happening here. And we know that for each dollar that's invested in permanent supportive housing, this saves $2 elsewhere in government spending. So whether that's homeless shelters, emergency rooms, but it takes very strong leaders and partners to get that kind of work done. What's happening in Cleveland is pretty remarkable. The Cleveland mayor, Mayor Frank Jackson, and local partners really put a stake in the ground and said, we're going to end chronic homelessness by 2020. And so they're putting data behind it. They're, a collaborative, kind of collective impact model with stakeholders sitting around the table. And it's, there's 1,200 folks that are chronically homeless in Cleveland. And what's really unique about this is, I think when we talk about what are some of the barriers to housing, one of them is a self-imposed one. You have to get sober, or you have to hit a certain clinical goal before you get into housing. It's very hard to achieve some of those goals if you don't have a safe and affordable home. So what Housing First does is say, get into a home, and then let's bring in the mental health and the physical health elements. That's proving to be quite successful, and homelessness rates in Cleveland have dropped about 62% since this has come into play. And I see that we're going to hit that goal. We're going to hit that goal definitely before 2020. Another area that I have been very inspired by and challenged by is the deep-rooted poverty in public housing. Enterprise had not historically been, Enterprise had not historically been rooted in public housing doing our work there, but as we look at where's concentrated poverty and where's that happening and where can we be high impact, there's a couple of places that we really want to, that we're working in. Number one, Hope SF. Some of you may be familiar with this. 8 very distressed public housing sites in San Francisco, where there are the highest incidence of child welfare cases, the biggest system costs. And so we're working with many partners, funders here in this room to try to catalyze solutions there. What this has looked like is, crime was rampant. We had 2/3 of the population was in poverty. Kids, chronic absenteeism rate from school, about 58%, compared to an average typically in San Francisco of about 6%. So we have a collective impact model there. We have the San Francisco Unified School District. We have the experts at Center for Youth Wellness who are dealing with ACEs, the adverse child experiences, the toxic stress, having folks gathered around the table to say, what can we do over the long term to really change the situation there? And it's very different in a couple of regards. One is converting that housing to mixed income, so that we have a range of incomes. Number 2, it's a collective impact model with those various sectors at the table. Number 3, we have real data to inform our work so that we can watch the trends and how this improves over time. And the most important thing is that the residents stay in place. Many times, as we're seeing public housing revitalized, you're seeing residents pushed off onto other places. The problems dispersed, not solved. This is a place where we're keeping residents in place, and we're doing very deep intervention. It is very hard, very challenging, and will be long-term, but we see some great potential in this and some great private sector partners coming in. Secondly, I would say, disasters continue, as we know, to have outsized impacts on low-income people. So after, in New Orleans, basically after the storm, we went down and we committed to do 10,000 homes in New Orleans. So we're well on our way of achieving that. One of the most challenging projects that we took on, ambitious, was in the historic Treme neighborhood, where we're revitalizing 900 public housing apartments and adding other apartments to make it mixed income. Recently, Whole Foods went in, and there's job training. A lot of folks are now employed at the Whole Foods. So we're having a first time. We have, fresh food in the neighborhood, connecting to anchor institutions like Tulane, bringing in, schools, and it's starting to change the whole vibe of the neighborhood and the impact and the outcomes for low-income families. So I raise these up as examples of things that I think are working. There's a lot of hope in these models, and I think that they can be expanded. Quickly, Something else right here that we're doing in LA, and we're doing it in other cities across the country, is to say we know that, for every dollar that's spent on housing, often 77 cents of that is given back in transportation costs. Unacceptable. Super commuters going 2 to 3 hours. We can't push families far out and think we're doing any great service. So, this is really to say you have things happening like in LA where you have huge amounts of dollars coming in where long-term funding streams are being set today, infrastructure being built around transportation, how we think about housing, and making sure that low-income families participate in the economic sort of conditions that are being set forward is absolutely critical. So equitable, transit-oriented development, making sure that you have homes next to transit, thinking about the environmental impact, what's happening with the economy, the schools, and how are those connected to transit systems. So we started this work in Denver, we brought it to LA, and we're expanding that out into 8 different communities. So again, taking something from a pilot to a scale, and we think that this has real significance on a national footprint. And one quick last example, since we're at an innovation conference, I wanted to say, enterprise green communities is something that I think what we suffer from a lot in our industry too is incredible fragmentation, not getting, together with the same voice. Enterprise green communities said, low-income families have the most to gain from living in green homes. It affects asthma. We've seen in some of our buildings asthma rates decrease by 66%. What's the number one reason kids don't show up at school? Asthma. You're in emergency rooms. So if we can bring down asthma rates by greening affordable housing, just starting there, pretty amazing. So that's what we're doing through Enterprise Green Communities, is proving out the notion that for low-income families, the energy efficiency, the water efficiency, how do we innovate around that to make sure low-income families are participating from the changes here? There's environmental benefits, economic benefits, and real health benefits. So we have actually a major 7-year study that we're looking at that data. We're going out and greening housing, and then we're saying, how does that change outcomes over a 7-year period? Mount Sinai is the lead researcher in it, but it's looking at 3 cities. And if we're successful in looking at that, then we'll have real data that will inform our choices. And then we can build that into policy mechanisms and set incentives, which is just what we've done through Enterprise Green Communities. And if I had more time to talk, I would talk about the innovation process that's behind that, because that was very much about being open source. Let's don't be closed and proprietary. Let's be open sourced. Let's do some rapid innovation and prototyping. And let's think about how do we get this into motion. And, we gave away little, what do you call those, the thumb drives, right? With all of our information and said, here's how you brand this your own. This is not about enterprise. Put your name on this, pass this out, and let's build that into policy mechanisms so that we can get much broader scale. So there's a lot of great stuff that's happening that we can lift up and get to bigger scale, but it is not easy and it's long term. The path ahead, we want to end housing insecurity in the United States. Super tough. We've got to expand the public programs that are working. Talked about tax reform, low-income housing tax credit. Chairman Camp came out with his opening salvo in tax reform. Low-income housing tax credit was protected, but others weren't. We don't know how that's all going to play out. It's going to be very challenging. I will say housing finance reform, we won't talk about that because I'm out of time, but maybe in Q&A. There are major opportunities in front of us right now as housing finance reform those programs get rewritten, and low-income families have been left out of that discussion. So Enterprise has has been doing a lot of work with our partners to get multifamily, low-income needs on that agenda. And I'm happy to say that with the recent bill that just came out of Senate banking, that most of that language was included. It's not perfect, but we're starting to make some good inroads. Private investment, that's one of the things where we're really trying to push the innovation, where it's pay for success, social impact bonds, new funds to attract retail investors. This is a way we are getting the private sector hooked. Come in, invest with us, and then we expand the footprint of things that we can do with them. Build capacity in other parts of the country. The public sector and nonprofit sector, we work hard to build that capacity. So we have a consulting organization where we're working in partnership, bringing our advisory services to 20 other cities currently. But that's how we're trying to say, how can we scale this? We can't bring our work everywhere, but can we go in on selected engagements? And then next generation of public policies, Ali Solis here, you met her yesterday. She heads up our external affairs doing public policy efforts, but we absolutely have to work together to think much more boldly and creatively about the public policy arena. And elevate housing and our issues on the national agenda. What's our master narrative? How are we talking about ourselves in a different way, in terms of some of the outcomes that we've talked about, breaking down those silos to really get traction on a national stage? I think there's some real opportunity here. And, you all know how to help. Invest, sign up, advocate. Let's do it together. So thanks a lot. Yeah.
Well, I'll make the mandatory comment that I'm between you and lunch after what sounds like it's been a terrific day and a half of conversation. I'm sorry that I wasn't here yesterday. That's usually the polite thing you say when you have to miss the first day of something, but I've heard enough just this morning to make me really sorry that I wasn't here yesterday. I'm going to just talk about 3 observations that I took from the papers that I think relate to at least how Casey thinks about how we ought to move forward, and then 3 lessons learned that I want to share with you from Casey's work. These are babies. There are 12,000 babies going to be born today, 360,000 babies this month. And we've talked a bit about this question of policy that alleviates hardship, ideas that basically will prevent individuals from going through poverty. If we think about these babies, not just as how do we protect them from hardship, but rather the answer to the question of what this country is going to do about its current economic situation, then I think we start to flip the narrative just a bit. And here's the 3 observations I want to share that I took from the papers and that relate to some of the ways that Casey is now thinking about our work moving forward. One is this increasing incorporation of an understanding about child development, about brain science, about the impact of toxic stress, adverse childhood experiences, trauma, etc., as relevant to public policy, not just relevant in some kind of clinical one-off kind of way, but actually relevant to how we think about poverty. It starts to open up a conversation about how our various opportunity structures and kind of the power imbalances that we have in this country, the impact of poverty and concentrated poverty, how that actually plays out in the lives of these 12,000 babies that are going to be born today, to either contribute to a deepening of inequality and a widening of the spread of bad outcomes, or can we think about it differently in a way that's going to give them better lives? Now, we've all known for a long time, and certainly the Casey Foundation has focused for a long time on the importance of early childhood development. We've known about the impact of brain development, the 0 to 3 movement, and I think Greg Duncan and his colleagues and Donna Pavetti's work in this is a good example of taking this research and translating it into practice. So we've known a lot about that. We've known that these 12,000 babies that are going to be born today, if they are growing up in households that are not stable, that don't provide a predictable kind of environment, don't provide a safe environment, that their prospects for developing their full potential is going to be affected. We certainly have known that. We're learning now in much more specific ways about the role of stress hormones in brain development, about cognitive development impacted by toxic stress, et cetera. So we've known that for a long time. We are increasingly becoming more sophisticated about brain development later in life, not later in life like my later in life, but like in the 16 to 24 age group. Now, I was telling somebody this morning that there was this terrible period of my life where I had 4 teenagers at home at the same time. And I think the question was something, Terri, like, was that a blended family or are you just crazy? Just crazy, but we had 4 kids within a 5-year period. Twins were in there. And so we had these teenagers around us, and it'll come as no surprise to anybody who's raised a teenager that their brains aren't quite developed, right? And as you've watched, as I've watched my children move into young adulthood, it has not been a shock either to realize that their brains don't completely develop until they're mid-20s, although for males, I'm told it's 68, so that's what I'm shooting for that. I'm really, hoping that those synapses are going to connect. But we actually now know more than we ever did that the game isn't over by age 3, 4, or 5, that in fact these executive functioning skills that Donna Pavetti talks about in her paper are very much continuing to be developed in adolescence. What's really interesting to us at Casey is how these things are all linked together. That in fact, if you think of that 16 to 24 or 25 age group, not just as their own executive functionings is developing, and they are becoming either more or less ready to be effective employees, but they are the parents or soon-to-be parents of the most vulnerable and the youngest children. And it turns out, this is common sense, that what you need to be a good employee, impulse control, multitasking, judgment, all those things are also necessary for you to be a good parent. So if we think about it that way, then that opens up a whole different way of how we invest, I believe, in human development, thinking about a twofer. We certainly focus on young children, as we have for a long time, and invest in young children, and we invest in that 16 to 24 age group from the perspective of preparing them to be successful employees, contributing to the economy, and to be successful parents. Now, again, from the papers, it's clear that it's not simply a matter of investing in individual folks. As Bob was saying earlier, simply increasing income can have a huge impact on development. And the more we learn about brain development, the more that makes sense. We actually know that when folks, if I were in a situation of scarcity, and I had to juggle many, many things at the same time, that would start to eat up my bandwidth, right? And we're seeing in social experiments, we're seeing in naturally occurring experiments, we're learning more and more from public policy research that simply adding income, simply adding resources of various types enables individuals to manage their bandwidth better. Their executive functioning increases, which frees up their energy to invest in their children, which again has a virtuous kind of cycle going on. So that's, I think, a very interesting part of what we heard. Next two observations are much briefer. Don't despair. Second observation is that as I read all of these papers and as I heard the debate today, I thought they're terrific examples of bringing a rigorous focus to bear on what works. Sort of looking at the data and the research to support the basic idea that in fact policy matters, that it makes a difference, and as importantly, that government is a necessary and critical part of our solutions here in improving the lives for kids and families. It's an opportunity to change the narrative and move past, on the one hand, what we often hear in research, nothing works, right? Well, guess what? We've got lots of evidence that lots of things don't work, but in fact, lots of things do work, and that government is the problem. In fact, I think we know from the papers that we saw, the conversation we're having, what we've learned over the last 20 years, to look back on the war on poverty, that in fact, government has to be part of the solution. Third observation is that, as Terri was mentioning a moment ago, I think we're becoming more sophisticated in gradually moving past the rhetoric about this, although the term is not great, collective impact. It sort of sounds like it ought to be some kind of Unitarian festival or something. But no offense to any Unitarians out there, but the point here is that rather than just talk in broad rhetorical terms about all the stakeholders have to be at the table, et cetera, we are gradually learning exactly what it takes. Let me give you an example. The reason I wasn't here yesterday is there's an emerging effort in Baltimore to try to bring together a bunch of foundations, the universities, the mayor, the school system, business, et cetera, to focus in on the entire span of development around children and try to do a better job, right? A lot of cities sort of taking up this idea. The Strive Network is just one example. And the commissioner, the secretary for health for the state is at the table, and he was bringing 10 indicators that he wanted to track about the health of children. And he said a very important thing. He said, we need to stay in our lane in the health department. We need to work on what we know. These 10 indicators have the common characteristic that they're all relevant to success in school. Terri gave a great example, asthma. You know, kids who have asthma aren't going to get to school. Josh Sharfstein yesterday had a whole bunch of other examples. The point is that he was bringing to the table, from this collective impact standpoint, here's our contribution. And the university president, the Hopkins president, the president of the University of Maryland at Baltimore, they were bringing to the table what they could contribute. And it was a much more in my experience, much more sophisticated kind of conversation than when folks just get around and they all talk about the problem and they leave and a few months go by and they come back. So I think that these papers provide some lifting up of examples and opportunities where we can reinforce efforts across multiple sectors. We heard about income and health and education and immigration policy and community development, et cetera. So some lessons learned. If I can, here it is. Sorry, babies, you'll be back later. So this is one bumper sticker, bad systems trump good programs. Imagine you're in the DMV, right, Department of Motor Vehicles, and you got kind of a complicated problem. And you're in line, and you're in line, and you're in line, and you're standing there, and if you're like any other human being on the face of this earth, you start to think, I could do this better. I could figure out a better system that would move us through this process. And then you notice there's like this sort of angry-looking, mean lady over here, and everybody that goes up to her, they walk away with a frown, and she's just not having a good day. And then there's this other woman over here who's bright and chipper, and everybody leaves with a smile, and you're like, oh, please, Lord, when it comes my turn, don't let me go to the mean lady. Let me go to the nice lady, right? We've had this experience, right? Now imagine that that lady is not just working on your car registration or your driver's license, but she's going to decide after a conversation with you whether or not your child's going to sleep with you that night. Then that notion of system, that notion of whether the system works or not, starts to become a lot more important. Or she's going to decide whether or not you're going to have the resources you need to feed your kids. So this bumper sticker of bad systems trump good programs basically goes to the very fundamental ideas that the way our systems work, and now I'm not talking about the broad public policy, I'm talking about the way the systems work at the state level, at the local level, the way they work can either open doors to opportunity or they can close doors to opportunity. So when I read the papers, one of the things that I was struck by is how many of those papers talked about specific, what I think of as gears in systems, that if you change that gear, in fact, the entire system would work better. I thought Harry's work on the sectoral and career pathway-based employment training, that's a good example of thinking about that gear and how that drives the rest of the workforce development system, or the community college remediation, the IBEST kind of approach is another kind of gear that we look at. Heather Schwartz's work on you need to stick longer at school improvement. The school improvement grants ought to be for a longer period of time because that's a gear that you can push, or that focusing on quality in early learning challenge grants, and not just sort of broad measures of quality like counting the number of teachers in the building, but rather looking at what makes a difference in quality is an example of gears. The bottom line is there are lots and lots of programs on the ground that work quite well. And I promise you that if they're connected to a system that is dysfunctional, the program either will not survive, or they will have lots of folks coming to the program who are being referred by the system who don't belong in that program, or have so many eligibility barriers that they're not going to use the program well. And I think I could give you lots of examples of that, but I instead will move on to the next bumper sticker. So, I have one of my sons who survived adolescence as a software engineer, and he used to talk about, still does, talks about kludge. You know, lots of you know what kludge is, but just in case there's anybody else who doesn't know what kludge is, when you're writing a software program, you usually start with something that's already there, and you want it to take on a new function, so you add some code. But it never fits quite right? So you add kind of complicated code. And over time, as you add code and add code and add code and add code to something that wasn't meant to do that in the first place, you build up kludge. And your program starts to crash. And I don't know, there's, whether it's Windows, no, I shouldn't say Windows, some programs crash, you know, and you can't figure out why they crash. Well, As you think about, and I owe this to Stephen Tellez from Hopkins, has this great article about kludgeocracy in American National Affairs in fall 2013. So this is kludge, right? So we have, and we know we have, as part of our political system, the way we make policy, and there's lots of good about this, we have this notion of disjointed incrementalism. We continually add to complicated policy frameworks as we move forward. The problem is that families at the core of this end up with exactly the problem that Bob was talking about, Terri was talking about, it's talked about in a number of the papers, which is the families have to negotiate their way through all this kludge. So one of the lessons is that kludge eats innovation for lunch. You're not going to be able to sustain innovation if you don't deal with the kludge. So, you know, it's one of the reasons why, there's a great statistic, and Bob, I think this is right, I think we might have even stolen this from you guys, but only 5% of families get all the benefits that they actually are technically entitled to get. Part of the problem is kludge, this notion of going to multiple places in order to do it. You know, at Casey, we've tried to work on things like centers for working families, sort of one-stop shops. You know, together with folks like the Center on Budget and Policy Priorities, we've worked on trying to make EITC and CTC application easier, worked with others around automatic benefits processes, the work support strategies, all these are part of this. I think from the papers, the work that Edgar did on really focused on project-based housing subsidies, which carry with it a lot of kludge, to more tenant-based kinds of strategies. I'm not a housing expert, but that sounded like a smart idea to me to decludge some of that. Barbara Wolf's work on expanding community health centers and putting them where the priority populations are located, so there's less kludge as you try to access those programs, and Heather Schwartz's work on really providing coaching to parents so they're making the right educational choices, et cetera. All these things, I think, are ways to deal with this kludge problem. Last lesson learned, stick with it till you get to scale. So obviously we're talking about a huge set of complicated problems in order for us to get to alleviating poverty. This particular slide, somebody else might do this differently, but this is a slide we use at Casey when we're trying to figure out whether or not we should invest at the next stage. And this makes things look a lot more linear, obviously, than real life is, but it gives us a sense, all right, so where are we on our path to some kind of scale? What I really liked from the papers is that several of them recommended that instead of thinking about a program going to scale, and I think this is really important in the nonprofit sector, we tend to think about programs in the nonprofit sector as if we were in the for-profit sector, and I think that's a mistake. In the for-profit sector, when you think about scale, you think about how do you market the program, how do you get more and more of market share, how do you get replication. You know, more is better. So if you have 20, if you get to 2,000, then you're scaling up. That's a good thing, right? In the not-for-profit sector, I think that's a mistake. I think we have to think about results. In other words, from the population standpoint, how many people are you reaching and how many of them are better off? And it's not necessarily the best way to get there is replicating a particular program. It may be replicating the principles behind programs, it may be replicating some of the techniques, some of the strategies, but it's a mistake to just think about replicating program. Not that program replication isn't critically important, but it is also incredibly difficult to do, and we've got a lot more experience in failure here than we have in success. So from my standpoint, and what I've sort of pushed us at Casey to look at, is it's a combination of evidence-based programs married to really important implementation science, so we know how to implement, to this kind of broad system reform, so it's nested in a system that supports it, and very importantly, policy change, especially around financing, because financing drives everything when it gets down to scaling up. I'll leave you with one example. Sorry, babies, not yet. One example, you know, and it relates to this conversation earlier when Sheldon, we had this sort of, well, are we pessimistic, optimistic, or whatever? So I'll tell you an optimist story. about 23 years ago, the Casey Foundation got involved in the juvenile justice space. And it was around the time of the so-called super predator debate. Do you remember this? That wasn't a drone. This was the notion that because of the crack epidemic, because of an increase in the adolescent population, because of breakdowns in cities, et cetera, et cetera, et cetera, there was a whole generation of predator teens. Now, I can tell you 4 of them, they were probably right, but there's a whole generation of predator teens that were going to come in and just lay waste to our society, and we, by God, better start building prison cells. We better start detaining more, we got to get tough. And you could not, as a politician, resist this wave. You could not stand up and say anything except, by God, you're right, we're going to lock up more kids. And our incarceration rate, our detention rate started to go up like this. That was the exact moment that the Casey Foundation, in its full wisdom, decided to take on juvenile justice and suggest we ought not be locking so many kids up. So I won't bore you with 22 years of work, other than to say we started in 5 places, screwed 2 up pretty well, 1, and 2 we did okay, but we kept pushing at it, pushing at it, pushing at it. This is sticking with stuff to get to scale. 22 years later, the Juvenile Detention Alternatives Initiative, which focuses on when you lock kids up before their hearing, like when you first pick them up when they do something bad, but you haven't had a hearing yet. We are now in 256 jurisdictions in 39 states. We track the average daily population in the detention facilities in those jurisdictions, and the average reduction is 43% in the places where we worked. So there's 43% fewer kids locked up. The entire thinking about juvenile justice has changed, not just because of us, don't get me wrong, of course. There's a lot that's gone into it. But the notion that the best way to respond to juvenile delinquency is to lock a kid up seems like an antiquated idea, and it's only been 20 years. Now, 20 years is a long time, but it's only been 20 years. The narrative can change. In fact, you can make a difference. So with that, I think I will set you free. Thank you so much.
Thank you, all of you, for really thoughtful discussions and reflections on the issues that we're facing. The conference is structured as a conversation. I've been saying that repeatedly. So I wanted to give you guys a chance to have a conversation. So I wanted to start by just asking, are there things that you heard in each other's presentations that got you thinking that you would want to speak to and maybe kick us onto a road of discussion?
Well, I was struck by the pithiness of something Patrick put up that said, bad systems trump good programs. And it particularly resonated for me because in our work, we are up to our eyeballs now in one problem after another, many of which have not been in the papers, and we don't want to have them in the newspapers, with implementation of the Affordable Care Act in terms of actual enrollment. And without getting into the details, one of the things it highlights is that when people, whether they're federal or state legislators, particularly at the federal level, when people are designing big, important things, I think often and not enough attention is paid to how does the administrative apparatus actually work at the state and local level to deliver the goods and achieve the intentions that are being set forth. We have all kinds of issues now on the intersection between Medicaid and subsidies to get coverage in the exchanges. Low-income people's incomes go up and down. You have to have a smooth system or a lot of people are either not going to get in or get caught through the cracks. We just last week had a meeting with the White House and HHS, and you'll find kind of amazing this hadn't been focused on, but the kind of thing you definitely think of, and they did think of in designing, is you have to have limited open enrollment periods. You can't let people wait till they're sick to come in. But in designing who gets a special enrollment period outside of open enrollment, what we found is there isn't right now, we just gave them a paper on this, I'm hoping this will change. There isn't right now a special enrollment period in the case of divorce. But income often drops a lot in divorce. If you go below the poverty line, you can get Medicaid. But let's suppose you have a married family. They're at an income level that they're not eligible for subsidies, whatever the setup. There's a divorce. At the end of the year, the divorced spouse is going to file as single or head of household. They'll look at her income for the year. She'll very possibly have been eligible for a subsidy. This isn't like the earned income credit, where you look back at the end of the year and you get a check. You can't get coverage retroactively. There has to be a system where your income falls, you get in. It's part of the larger thing of thinking about what happens when there are changes in circumstances, because the poverty population is so dynamic. It has so many changes in circumstances. This is just one little example. But too often there is this sense of, I've got the great policy idea, I finally have the political support. I don't have to worry about the details. The administering agencies will all figure that out. But you have to design it with a framework that allows it to be thought out in a way that it actually works. And I just think this is, the most important in many ways social policy innovation in a long time is the Affordable Care Act, the potential to cover 30+ million people. And it's just an object lesson for all of us that we have to think as much about designing the systems as the policies when we're creating new policies.
I obviously agree with that. I'll take it to maybe the next step. There's the question of learning as it's implemented something as complicated as the ACA, and therefore adjusting the policy levers, if you will, in terms of what's permissible. If one controlled everything, it's a stroke of a pen kind of change, if you will. And then it's not but it's in addition to that, there's the on the ground, how people interpret that and how they work with it. So I'll give you one quick example. Most of our foster care systems in the country, the states, are essentially similar in design. They operate under similar kinds of rules and regulations. There's some differences. If you're in one state, I won't name states, if you're in one state and you're removed from your home, your odds of being in a foster home or in a home with your relative are about 90 to 95% in a particular state. If you're in another state, your odds are only about 70%. In other words, the rate of kids who are in an institution, in a residential care, in a sort of a impersonal group home are about 30% in one state and about 5% in another state. Same rules, same policies. So it's really, I think, Bob, a both and that makes it, of course, all that much more complicated. But most foundations, most of us don't tend to focus on either the details of the policy implementation or the nuts and bolts, the blocking and tackling. You know, we've gone into many states and we've reduced our congregate care rate significantly. Mm-hmm. And it has not been by changing laws. It's really been by working with them on how their systems function. So it's really a both, it's a both end.
And I would just say, you guys are, in some sense, channeling what I've been saying here for why I actually do Bedrosian Center and not the real estate group, in that too often, we think a lot about designing programs. We're a bunch of economists. We figure out our incentives. We know how to do that. The blocking and tackling, the nuts and bolts stuff, that actually is hard. It's non-sexy. It's tedious, but it is incredibly important. And we don't have enough people who are actually trained to be experts in that, so that when you build your team and you think about who's going to be doing this stuff, that's the person who can do this and who's going to make sure that we set this up in a way that actually works. There are just far too few people that do this, and it's one of the reasons why, I think the more we talk about it, the better off we'll be.
Yeah. Go ahead, I'm sorry.
No, I was just going to agree, and I think that where we've seen that on the ground has been in, I can think of a lot of examples of that, but, where it was most evident to me was the work around the foreclosure crisis, where you had, a lot of regulations, a lot of programs without regard for how does that really work and apply on the ground. And so there was a lot of information and misinformation, and continually need to be channeled for what is really happening in low-income communities, and making sure that we could get that back into the system. And as something like neighborhood stabilization program came out, which was fairly massive resources going into low-income communities, but if they weren't flowing in the right way or in a usable way. I'm looking at my colleague Jeff Schaefer right there, who headed up the efforts here in Los Angeles using some of that money. But real systems change and process changes had to be adapted and put in. So we got sequentially better over the first round, second round, third round. But if some of that had been thought about up front, it certainly would have been a much more effective use of resources.
So I think a major challenge, and I'm not sure what's the best way to make progress on this. This is something the Salt Price School should look into, foundations should look into. Again, the Affordable Care Act is one, but only one example. We have a really serious problem that we're increasingly in an information age. Things are online. Systems work through online. But governments, federal and state, do not have on staff people with the kind of teams of people with the sophisticated IT technology to design these systems themselves. They contract them out. The contracting firms are not experts in the details, in the nuts and bolts. What do you do when someone's income changes? How does this interface with that? And the people in the federal and state agencies who manage and oversee the contracts, they kind of have these broad contract management skills. They're not experts on the details of the program. Now, we can see this in spades in the Affordable Care Act, but it's way beyond the Affordable Care Act. There was an important column, I think it was the New York Times, I forget the paper, by David Super of Georgetown Law School about 6 or 8 weeks ago, cataloging in a number of states around the country when various IT systems were changed, glitches that came up where hundreds of thousands of people suddenly were shut out or couldn't get renewed for SNAP or Medicaid or whatever. The example that we experienced that kind of stunned us at the center when we came across it, but it's a great example of this. In the late 90s, the federal government did something very important, and it put out tri-agency guidance covering food stamps, Medicaid, other programs, in which citizen children in immigrant families are eligible, but the parents may be undocumented. And the question was, what the guidance said to states is you cannot set up your applications in ways where the parents do not apply for the children because they would fear they would endanger themselves. And we were in a largely paper application for program world, and the paper applications were fixed. Today, we're overwhelmingly in an online application world. And about 2 or 3 years ago, our staff at the center got the idea we're going to take every state's SNAP application and every state's Medicaid application, and we're going to try online application. We're going to try and apply online as though we were an undocumented parent trying to enroll a citizen child. And we figured we might find a few states where something was wrong. Almost every state in the country, it didn't work. Nobody had, when the IT contractors and the IT firms had done, you'd go through and you'd go to hit submit and it would say, you missed this field. Well, the field would expose the undocumented parent. When we took it to Agriculture and Health and Human Services, they were stunned. Nobody had looked at it. The contract management people and the policy people were siloed. Now, they went back to every state and told them to fix it. It's largely fixed in SNAP. We're not quite all the way there yet in Medicaid. But all of this is kind of making me think we have to solve this problem somehow. We have to get better government performance vis-a-vis IT and IT contractors in the major public benefit programs, or we're just going to keep having these problems. I'm not sure how we get from here to there, but I think this is a pretty serious problem.
So it definitely is, and I'll just say, I lived this problem for 3 recent years, where HUD has we have programs that are still in COBOL, right? So the notion of how you do upgrading and what you can do and what kind of expertise you have in-house versus what you got a contract out for, and the concerns about corruption and procurement have led to separating these functions explicitly. And all that separation tremendously reduces the ability to have the coordination and make sure all the issues come up in real time, actually before real time. And then the other piece, which is also important, this is true not just in IT but in contracting out generally, is that it's a political winner to have things on contract as opposed to hire people on staff, because the government looks smaller, even when the functions need to be done. And so a lot of the contracting out happens for expedience reasons, so we can say we shrunk the government and the stuff shows up just in another line item, but that has functional implications that I don't think are fully understood and fully appreciated in many of these instances, and you guys have just stumbled upon one of them. I want to actually go to a different issue. Patrick, you were talking about your meeting yesterday in Baltimore, where all these folks came together. They all bring their various pieces of expertise to the table. Who manages this? Right? And I mean, it seems like massive resources are now being made available, but how does this play out in a way that we're confident that something concrete emerges that actually is it stays on the point that we're trying to be on?
So I don't have the answer for that. I'll share what I know about the field here, which is that just in the Strive, people who describe themselves as loosely affiliated or doing a Strive type initiative, I understand from Jeff Edmondson, it's in the 80s cities around the, 80 some cities are doing this. And I think Jeff would say, if he were here, that maybe 20 of those 80 are actually taking it up in a way that he would consider to be consistent. And I think he would also say we're still learning a whole lot about how it works. I think it starts with what we at Casey call results-based leadership. That is, it's building on a very much of a data-driven clarity about the results you're trying to achieve, commitment to measurement, training of not just the top leaders but the middle leaders in how you actually put that in place, so there's rapid prototyping and learning from that, and then continuous improvement, knowing that this is a long-term, not a short-term kind of approach. The management part of it, different folks have tried different things. Some have sort of turned to an existing entity and said, foundations or others have stepped up and said, we're going to pay you to basically manage the herding of cats, as Jeff would say, to manage the process itself. Others have started new organizations. In Baltimore, we're in early stages. I think we're going to end up with some hybrid of that. We've got United Way at the table. We've got folks at the table who are used to these kind of broad things. But it's a highly complex, high risk in the sense we could end up spending a lot of money and time and not get the results. But in today's world, I'm not sure how else we start to turn around a city like Baltimore unless we have the folks who control the resources at the table agreed to mutually hold each other accountable for certain results. I don't know how else you get there. And in a place like Baltimore, where if you were to take out Hopkins and the University of Maryland and T. Rowe Price, and Casey, if you sort of took out some of these major actors, there's not a lot to work with there. So we don't step up, nobody else is going to step up. So I'll let you know in a few years. But
Well, I was hoping you had a silver bullet for us
Yes,
that I
I
could
know.
just say,
It's
go
just-
do it in all these neighborhoods that we're
No,
trying to change.
The reason why I say I think we're getting more sophisticated is I think we're paying much more attention to data, to results, to getting beyond rhetoric, to learning from others what they're doing, and to this notion that it really is long-term. It really is about changing systems. You got to have the mayor there. You got to have the school superintendent. You got to have all these folks who control the resources, and that's why I'm optimistic that we're learning more. But it's a tough nut.
All right, so go ahead.
No, I would add to that one of the things that we see is I think the philanthropic and the resource piece is really important, that those are such drivers, because I think in our experience, and Annie Casey thankfully is a terrific supporter of the Hope SF work that I framed up there. But one of the real challenges with a lot of these models also is as you move there, many of them need to be very long-term by nature, and as you move past a political administration, you start to lose some of the will or completely different direction. So I think one of our big lessons in Hope SF, I would add, is I would build on everything that Patrick said, the having a common goal, having the data-informed system, the longer-term time frame. But I do think having that collection of folks that can help drive resources and create, redundancy is not the right word, but it's something that sort of steps aside and surrounds the political environment in a way to ensure the long-term viability of a project. And Hope, so a place like Hope SF, so that was Mayor Gavin Newsom that kicked it off. But now you have Mayor Lee, and he's just as strong. But if he hadn't have been, how do you make sure that you're building that kind of resiliency of an effort over the long term? And I think it's through that kind of philanthropic leadership. I think it's by having actually being able to hopefully staff, also build up a real, not extensive staff, but to actually have some people that are very dedicated to this and have the various sectors behind them. So.
All right, so at this point, we should open it up to the folks, have you join the conversation. And we have people who will be available with mics, and please remember to say your name when you speak. So we'll start with Roy.
This question is for Terri, and actually a two-part question. We really haven't talked a whole lot about banking policy at this conference. And the CRA credit, Community Reinvestment Act, how important is that in encouraging banks to loan money for low-income development, housing developments specifically? And also, is there some legislation such as the Dodd-Frank laws that maybe have restricted banks' ability to partner with local nonprofit organizations to lend money for mortgage loans to particularly low-income families?
Mm-hmm. Sure. So I'm assuming most of you know the Community Reinvestment Act, or the CRA, is a federal law which says banks, if basically you take deposits, that you need to reinvest in your communities. I would say that's been absolutely essential for a lot of the work that's been done in our communities. Those are the major capital flows that are coming in. I'm talking about the billions that we've done in business. We're aggregating and leveraging capital primarily from the banks. As I said, that's expanded from people that aren't under that kind of incentive system, but it's absolutely essential. And we've done a lot of work over the last number of years to work with all the regulators to try to think about, is there a better way to modernize the Community Reinvestment Act, to recognize some of the inadequacies it has. For example, it tends to flow to high-cost markets quite well. It tends to incent capital flows on the coast, but not in the middle of the country. And there's all sorts of reasons, which I'd be happy to expand upon. But short version is there's lots of improvements that could be made on that regulation. But I think absolutely it's a driving force between, to really incent banks to come in. I think the question has been raised in a lot of circles, why only banks? Should there be a broader sort of incentive system to encourage other players, whether those are insurance companies or other corporates, to come in and participate in a similar way? What would be the viability, some of the challenges with that? That's been debated, so I throw that out there as well. In terms of Dodd-Frank, I guess I would say I don't know. I really don't know the answer to that question. I will say my experience with Dodd-Frank is that it is, just in terms of the people we deal with at banks are very, there are some restrictions in terms of just their ability to be a little bit more creative, take some risks. Certainly where they put, equity investments in terms of their risk capitalization looks different, particularly under Dodd-Frank. So there are certainly some implications that we have to think about over the long term.
Greg Duncan, UC Irvine. I have a question about how we frame our arguments. You all make connections at very high levels with not only advocates but also the business community, with not only liberals but also independents and conservatives. I think those of us who went through welfare reform, it was a very contentious debate. It led to a consensus that no one was absolutely delighted with, but it did support work in a pretty serious way. With time limits, it led to a large increase in the employment of single women. And I guess some of us kind of thought that debates about dependence would have faded into the past. I think arguments like return on investment, in the case of certainly early childhood programs, gained a lot of traction in the last over the last 15 years, but you don't hear those arguments as much as you used to. Are we just reverting back, with this latest round of arguments about hammocks to the way people were thinking back 20 years ago? Is it a fundamentally different way of thinking about things? And how can we frame our arguments in light of how people are thinking about things now that will advance them?
I think Greg is absolutely right. It's kind of striking to a number of us who have witnessed or in various ways been involved with the transformation, isn't too strong a word, of the safety net over, say, the past 30 years into what analysts regularly and accurately now call a work-based safety net. If you go back to the mid-'80s, most states had general assistance, cash assistance programs for single individuals without children. They were not limited to people who were severely disabled. The majority of states and localities in the country, that's pretty much gone today. In 1995, for every 100 families with children below the poverty line, 68 received cash welfare assistance. Through the old AFDC program, we're down to about 28 out of 100 now get any cash assistance at all. We've really moved to much more of a work-based safety net. And so on the one hand, there are echoes, or more than echoes, of the old arguments. But I don't think they're as effective as they used to be, in part because one really can bring to bear the data, the figures, for example, that show the transformation and the degree to which people are working. So we saw this in the big debate that we had in the second half of 2013 over food stamps. We had a bill that went through the House that had $40 billion over 10 years in cuts in SNAP benefits, and a really onerous work-related provision that was billed as a work requirement, but would have taken a lot of people off the program and left them with nothing if they couldn't find jobs on their own. And the hammock arguments were widely used. But at the end of the day, all of those provisions disappeared from the bill. And it did get bipartisan support as part of a farm bill to pass at the end. And there were many factors related to that. But the fact that one could very heavily push back, that you could show that the share of people on SNAP who aren't working and getting welfare assistance is now low, and the percentage of people for whom it supplements low wages is much more substantial. I mean, all those arguments really helped. I think there's another factor here, and it gets back to my budgetary discussion. So the person who probably is most effective, in part because he's a very effective communicator, in making these arguments is Paul Ryan. Now, Paul Ryan's his new budget will come out on Monday or Tuesday. His last several budgets have gotten 3/5 to 2/3 of their budget cuts from programs targeted on low-income people. And in order to help defend that, you need to make the dependency argument. But it's not really rooted. The context isn't just one of a welfare debate. The larger issue is the following. Paul Ryan, actually, if you talk to him personally, is not some vicious guy who wants more poverty. Ryan, to pass a budget in the House, it has to balance the budget in 10 years. To balance the budget in 10 years, you need trillions of dollars of deficit reduction. He starts with the following framework. No revenue increase to deficit reduction. No cuts in defense. For political reasons, no changes in Social Security. And contrary to what many people think about the Ryan budgets, hardly any changes in Medicare for current beneficiaries. His controversial Medicare provisions start with people who newly retired 10 years down the road. If you want to get trillions in deficit reduction and all those things are off the table, you have two places mainly to go. You go to non-defense discretionary programs, which I talked about, and you go to means-tested, low-income entitlement programs. And then your budget cuts are so big there, you need a narrative. So part of the pushback, I think, is explaining in clear, simple terms the degree to which the safety net increasingly is a work-based safety net. But it's also embedded in these larger budgetary discussions. And we have to have more things on, not only on the tax expenditure side, but on the spending side, on the table. And if we can do that, I think that helps with the debate on resources for poverty programs.
Hi, I'm Nancy Gannon Hornberger from Say San Diego, and I appreciate all your comments. I would like to ask a little bit about social impact bonds or pay for success strategies. They've been touched on the last couple of days. You know, novel idea. There's a lot of traction to the novelty. I don't know that there's been a whole lot of analysis. So I'd be interested from all of you in your analysis on those strategies, what you've seen in terms of pros and cons, and in particular with poverty solutions. Thank you.
Sure. So I don't know that we've seen good examples that are specifically focused on poverty. Certainly not in this country. You know, I'm a skeptic about social impact bonds in the way that they're usually structured, which is not to say that I'm against the notion of let's do a lot of experimenting, because it could really be, I think some version of pay for success could be a way to open up lots of opportunity, and actually might even get a little bit to Greg's question, because one of the things you have to get over is a sense that, well, nothing works, et cetera. So if you have a pay for success model, it helps to do it. My problem with social impact bonds, as they've currently been structured, is they tend to be focused on a programmatic solution, so it doesn't get to the systems change. So you take the Rikers Island example. We're locking up a bunch of young folks who don't need to be locked up. Data are pretty clear on that. So we've got a programmatic intervention that says after we lock them up, we're going to provide a program. Oh, but it didn't really work when they first put it in place because Rikers Island is itself a system. So they had to sort of add it into Rikers Island. And they haven't really changed the systemic part. It doesn't mean it's a bad thing to do. It's actually, they're getting good results. It's a good thing to do. But in terms of distracting from the fundamental problem that there are alternatives to locking the folks up in the first place, these are young offenders. Second problem that I have that I'm not an expert on, but I have questions about, not a problem, questions about, is the way it's structured. You know, Goldman Sachs ends up making their money back at a certain cutoff point, and then on top of that, a lot more money back, and yet they're backstopped by philanthropic resources. So on a risk-adjusted basis, their actual return is pretty doggone amazing. Now, having said that, somebody had to step up, and now I think Goldman Sachs is getting smarter and smarter, and the folks on the other side of the deal are getting smarter, and this is probably part of the natural process by which these things evolve, and I think that's fine and important. I don't know that we've figured out how you build in that kind of virtuous cycle we need to get to, where the money that you save from not doing stupid things with that money gets reinvested in a permanent kind of way in prevention and early intervention, so you start to actually change the pipeline at the same time that you avoid sort of the bad things. I think there are ways to get there, and I think philanthropy has a role. We're looking for an opportunity right now. So that's a long-about way of saying really interesting stuff. I think the jury's still out on whether the particular social impact bond approach works, as opposed to there are 3 or 4 other approaches to pay for success that I think might be more interesting over time. I'll be interested to see how the Department of Labor's work in this ends up. That's probably more relevant to the poverty piece, but it's too early, I think, to tell. That's my take, at least.
Yeah, I'll add to that. You know, at Enterprise, we're doing a lot of work for pay for success, and have had some very interesting mandates, and really excited about the field. I would say one is sort of a theoretical. Why I'm excited is because I think it captures the imagination of people that otherwise would not be interested, and we're starting to see some folks, private investors, come in, and it is this notion in terms of framing. It's pay for performance and return on investments, and really wanting to see something that is data, you know, analytical and performance-based. I would say where we're applying our expertise is in a couple areas where, you know, we have a mandate that I think Patrick and I were talking about this recently, you know, on a program to prevent homelessness in New York City. So by, you know, a relatively small investment, you can prevent folks that are right at the cusp of falling into homelessness, you know, not fall into homelessness. And there's programs that, you know, you can see over a long period of time, you can verify, you can look at the results. So it's prime for a pay for performance type of investment. And we've seen that come into play. We think those are the types of things. It's interesting because we had that mandate, and actually, it's not going to be it's not going to be a social impact bond, as it turns out. But we convinced New York City that they should be doing this and actually spending their money to do it. So we count that as a win. But as I think Patrick and I had talked about, the win is then also making sure that those savings that do come through the system get channeled back in. So we do have to think about the whole system's interplay. We're also doing social impact bonds, talked a little bit about the green agenda. That's where there's some really readily available data on some of those outcomes, and we can look at doing pretty broad scale greening by doing pay per performance type of instruments, and so we're working hard in that area. But there's a lot of different areas we're touching upon, and I'd love to have a more fulsome conversation because I think it's a ripe area for financial innovation. I would also say that I wrote an article in the Federal Reserve in the paper on social impact bonds, and my primary point on that is let's don't also just go from scratch. We have things we can learn from. So something like the low-income housing tax credit, the reason it's enjoyed bipartisan support is because it is largely a pay-for-performance type of instrument. So let's learn from something that has been, a multi-billion-dollar industry, and how did it get there? And the reason I say low-income housing tax credit is like a social impact bond is because what happens is you have government sets a tax incentive, private investors come in and essentially build housing, right? And then once that housing is built, then those tax credits start to, a private investor actually helps, pay for that. And then those private investors get those tax credits. And those tax credits don't flow until that housing is built. It's occupied by who it's supposed to be occupied. And then those tax credits start to flow. And that's all based off of data. And then also it has a compliance period. So if you do not perform relative to the agreement on low-income housing tax credit, there's a clawback. So you don't get your return, just like a social impact bond, right? And there's different actors in different positions, places we can learn from that and do some shortcuts. So I think there's a lot of valuable lessons to build on.
I would describe myself as an intrigued skeptic, probably similar to where Patrick is. I worry a little bit about the potential for social impact bonds to become a buzzword before we have enough evidence on how much we can use them and what we can use them for. I worry about them charging into fields where it's very hard to measure results and or very hard to actually show the positive results. So in the case of the low-income housing tax credit, you can build the housing, and you can rent it, and you can put people in it. But when we're talking about things involving social behaviors and other kinds of things, it could turn out to be significantly more difficult. So I'm very much where Patrick is. We should pursue some demonstration projects and test this carefully with some caution. The one caveat is unless and until we find that this can be used successfully on a significant scale, we need to be careful not to have it sort of become a partial justification for having the government invest less in certain basic functions we need because, the private sector will just take care of it through social impact bonds. So again, I think it's really an intriguing thing to look at and to test and pilot, but it's not yet ready for us to jump on and say, this is the answer.
Bob, I completely agree on that. And I think even the language we use, like social impact bond, those that are familiar with a bond, most of them, it's not a bond, right? And so I'd rather it be called an equity or something so that it implies the risk, because I think that some of these things happen and they don't work. I think there's a lot of room for some of the adverse consequences that were just talked about.
So we have time for one more. Bobby, you had a question?
I do have a question. When I listened today, I think all of the speakers are convinced that we have to use evidence. So whether it's Vicki talking about the Green Initiative or Patrick talking about being evidence-driven, Bob's always evidence-driven, and Sheldon, we all had this flavor. And yet yesterday there were a lot of people who are involved in doing really innovative things, and part of the whole focus here is being innovative. How do we evaluate or get people to agree to those evaluations so that we can, in fact, use them? I know Harry said, well, we have to wait 10 years. Well, young children really don't have 10 years to wait. So I don't buy that we have to wait 10 years. It doesn't mean we have to do it instantaneous. So I guess I'd really appreciate some discussion about how we really take some of these innovative ideas, get people to be willing and open to having those evaluated. They don't have to work for everyone. If we look at the one that we have focused a good deal about that Cabria talked about, she suggested she thought from these small numbers that it was working for people 25 and over and not for younger individuals. Programs, may be effective for a particular group, but how do we learn this? And if we're going to use these resources and be successful and, in fact, try to change the dialogue, we have to have programs that work. Spending dollars on things that are ineffective doesn't improve anything for the poor. So just throw out the question to all of you.
I think it's a great question. I do think sometimes this is an area, since you may need public resources both for the initiative itself and for part of the evaluation costs. I think, and others can speak to this, that there are places where an evaluation and a whole demonstration project probably would not have happened had it not been for the presence of some major foundation partners helping to cover part of the costs of the evaluation. We've talked about the Work Support Strategies project. All of the evaluation money is foundation money there. The one that, there are many, this is just based on what I know. Sheldon and I were talking about this last night over a glass of wine. I would love to see a demonstration project, because we already have some important data, was the fact that in the Recovery Act, in the 2009 Recovery Act, Donna may have talked about this yesterday, there was this temporary assistance for needy families emergency funds. One of the possible uses was subsidized employment, primarily in the private sector. Within 15 months, there were 250,000 subsidized jobs, low-income parents and youth, people who otherwise often wouldn't have been hired even in a good economy, got 6, 9, 12-month job slots. It worked from an implementation and administration standpoint. It wasn't set up with a longitudinal evaluation. Mark Elliott's group, I'm blanking on the name, in Philadelphia. Economic Mobility Corporation did, you wouldn't quite call it an evaluation. They did the best they could with the data we have. And in Florida and a few places there were more data, and they showed some people staying in jobs. But we really want to know, what are the longer term effects of this? And it has implications for, if we could have something where we have, on an ongoing modest size basis, public sector job creation, subsidized jobs, primarily in the public funded, primarily in the private sector, for people who otherwise aren't going to get hired. And then when the economy goes down, you ramp up the program and you have a larger number of subsidized job slots, and as the economy recovers, it ramps up. But you always have some. What are the impacts on formerly incarcerated people who can't get jobs? What does it do to minority youth who don't have that first job in the job market and may otherwise experience scarring, employment scarring of years of? There are potential really important things to learn here. And I'm hopeful by the fact that a lot of the states that ran this and loved the program were Republican states. There were 40 states that did it in 2009 and 2010. So, maybe with a combination of, if one could get some bipartisan interest on the Hill, maybe coming out of governors and some foundation partners, maybe at some point in the next few years. There are a lot of conservative analysts, people at the American Enterprise Institute are big fans of this. Analysts across the political spectrum find this idea intriguing. It's work, it's employment. So, but I think that's another part of it, is where one can get bipartisan agreement that this would be an important thing to test and might have useful policy results. That also makes it more likely. So that's a factor. Foundation involvement is a factor. But I think it's a very important question, because we need to identify several really important things in this area and have major high-profile demonstration projects that hopefully could have big impacts on future policy.
Please join me in thanking Terri, Bob, and Patrick. Thank you. I wanted to just say thank you to all of you. To all of the paper writers, You guys did a great job in helping create a framework for our conversation around these issues. I want to thank all the presenters because you brought some real-world grounding to make sure that this wasn't just another bunch of academics talking to each other, but we wanted to really try to make it real and bring it to the ground. I want to thank folks at USC, the leadership here, the dean, Robert Price, the provost. This has been supported from a broad range of our resources. I want to thank Richard and the folks at the Price Center. Matt, thank you for the photo exhibition. And just so that you all understand and appreciate this, the community was not just the people in this room. We had a significant online presence. The live stream had over 350 people who were watching it through the course of the day. If you're on Twitter, there's been an active dialogue and discussion there. We have some really 500 people, so another 150 today. So the community is large, and I want to thank all of you for joining and participating in that. So just to sum up, there are three things I wanted to do. One is just say we heard a lot of issues through the course of this day and a half. Issues about how do we get broad and continuous and deeply engaged multi-sectoral participation, the important role of the private sector, the important role of a general economy, and income support to make this, to make change real. We heard a lot about institutions and systems. Today we heard about tax systems, program structures, incentives, IT, and I didn't even think we were going to go to IT. But all of these systems and how we implement plays a huge role in terms of what we can accomplish. And so thinking hard about that is important. There was a lot of discussion about the tension between practitioners and researchers. And can we find a sweet spot where we can communicate, work together, and advance each other's interests so that we can be mutually reinforcing. And there was also a lot of discussion about perseverance and the long-term nature of what we're talking about, and how the reality that change takes time, it butts up against political realities, personal impatience, and just what you can show in terms of evidence. And we have to figure that out. We really have to figure out how to make sure that our efforts can span the fluctuations that happen in other spaces in important ways. So I was asked, I've been asked many times through the course of the day and a half, so what's next? What are we going to do with all this? And I would say a couple things. First, we have a lot of great ideas to work with. Through the course of the papers, the discussions, the conversations that have happened offline. There are a lot of things that we can lift up, and part of what our challenge is moving forward is to distill this down into something that is clear, transparent, and actionable. And so over the next couple of weeks and months, we're going to work to do that, develop some action plans, some communication approaches, and ultimately, we've got to disseminate and communicate. Get the word out, and be as precise and specific as possible. Because one thing I will say, lots of folks want to do things, but they don't know what to do. So you have to say more than just, we need to do something. We need to do these things, and hopefully we'll be able to get that coming out of this conference. And I'm going to ask, fairly forcefully, for your help and partnership in that effort, because our institution, we're large, we have resources, but we are not the nation, and a network allows us to reach far more people. So I'm going to count on you for that support, and I'm thanking you in advance for it. And then finally, I want to end the way we started. So look around, look at these pictures, and just reflect on who these people are, and what their hopes are, and what their dreams and aspirations are. Because these are the people we're talking about. These are people we have been talking about for the last day and a half. And these are the people who we need to do better by. And we need to make sure that our country does better by them. So it's time to go forth. But what I'm hoping is that the conversation that we've had for the last 36 hours continues. Here, out there, over dinner, online, through emails. We need to keep talking about these things. We need to keep working together to figure out what to do, and then we need to start doing things as well. So let's go do it. Thank you, and have a great weekend.